Okay. Thank you for tuning in to another episode of the Heart of Medicine interview series. This week we were expecting to post up our chat with Marguerite Dinkins and Craig Mitchell, but we've had to postpone that for now, but we'll keep you updated as to when you can expect that. For now, we had a great chat with one of our lecturers from Endeavour, Paul Joyce. Yeah, talked about some interesting things with him.
So the interesting thing with Paul is that he's an Australian practitioner and he's been practicing Chinese medicine for 10 years now. And in that time he's also lectured in Western medicine in a university setting. So it was really interesting to see that dichotomy play out in both systems. Paul has also done a lot of Qigong work on the side. And it's a huge part of his personal development, and he shares some really, really great insights too, and what it's done for him and how it's changed him as a person. So I think that in itself is really valuable, right?
Certainly, yeah.
He then also goes on to talking about some philosophy, Daoist philosophy, which we absolutely love.
It's been a very big influence on how he even came onto this path as well.
So we won't spoil it, so we really hope you enjoy the interview, and we'll be speaking to you soon.
Thank you. Yeah, thanks for taking the time after a day of classes to have a chat with us. We just want to start with, for those listening who don't really know your background, how you sort of came down this road of medicine.
All right. Well, what happened was I ended up... I was about 19 and I started, I was in a bookshop, and I'd always tended towards anything Chinese culture, basically from 3 or 4 years old, from a very early age. And I often, in my teenage years, used to... this is a bit, it's not really that important, but I used to practice a lot of stick fighting.
Oh, cool.
And then I was about 19 and I went into a bookshop in Petersham, picked up a book called The Tao of Physics and started reading it and started getting interested in this idea of Tao. And then what happened was I started reading more and more books about Chinese philosophy, and then one day I think it was in Stanmore, and I went into a bookshop there, and I think that was when it, in a way, like the door was open, because I found a book called The Wenzi, and I'm not real sure about it, but it's supposed to be one of the books that Lao Tzu wrote, and I read that book, and once I read that book, then I was sort of pretty much interested after that, But so then what happened was I applied for university, and I went to UTS for 1 year. And before that, actually, before any of this happened, I met Dr. Wang, and he's been my mentor for nearly 20 years. And he's a guy who works down in Kingsford. And so I went to see him because I was quite sick, and he helped me a lot. And what happened was, after some time with him, I sort of realised that that's what I wanted to do, and then he encouraged me. And so anyway, I got into UTS. I did 1 year there, and then Dr. Wang said, I'll be honest, he said UTS no good, because at that time, and it's not like this anymore, but it was like this, acupuncture and herbal medicine were both separate degrees. You know what I mean? And at that time, I was in the herbal degree, and so I wasn't actually able to ever, in a way, do the acupuncture. Yeah. So he said, go to RMIT, and so what happened? My girlfriend at the time and myself, we packed up. it was a bit longer than just that, but basically we both got into university in Melbourne, and then we both moved to Melbourne, and then I did all my time. I did 2 degrees in Melbourne, a human biology degree and a Chinese medicine degree. Yeah.
So where did the Western medicine part come into it? Was it before the UTS or during?
Well, at UTS we had to do Western medicine as well, but at RMIT they had what's called a dual degree, where it was a human biology linked with a Chinese medicine degree.
Ah, okay.
And at that time, this is what was said. It was the closest degree of its sort outside China of sort of addressing Chinese medicine. So anyhow, I ended up doing that, and what happened? I went in the final year. I went to Nanjing, spent a year in Nanjing, and then I tried to do Chinese language, like I was saying before. I tried to get a scholarship. Very, very hard I tried. You wouldn't believe how hard I tried, but I couldn't get a scholarship. So what happened, I think a man in Beijing felt sorry for me, and he ended up giving me a job at another university, and I stayed in Beijing for an extra year.
Wow.
And while I was there, I met my wife, like you guys know. I met my wife, and then I think it was about 3 years later, we moved back to Sydney and set up a family. That was when I really got serious about having my own clinic, and started that. And also, as you guys already know, I taught Western medicine for 10 years.
Yeah.
So I've done a bit of both over the years.
So you'd never had a GP practice or a
clinic? No. I had a Chinese medicine clinic. Yeah.
So you were teaching like the biosciences, and then on the other side, working as a TCM practitioner.
Chinese medicine practitioner.
Yeah.
And some of the students because the last 6 years working at the university, I was in a medical school. So some of my students would say, "I don't know why you're here, Paul. You're such a misfit in this class."
And how would you answer?
I just used to, no big deal. But I think in the end, that was why I ended up being, in a way, forced out of that place, because I was a misfit in that medical school.
Yeah.
They found out about it.
What was the most what characteristics about that environment made you think, nah, this really can't be in this environment?
Well, I could be in that environment because I didn't, in a way, financially, I relied on that environment financially for a long time. So, but the whole time I was there, I really felt very strongly about these guys are just, they really don't have very much of an idea about the human body whatsoever.
Okay.
You know what I mean? Because as I said, I'd seen patients for a long time in my own clinic, and I'd seen and I'd also heard everything they had to say about Western medicine in the medicine degree, and to be honest, you can really, it's such a stark thing when you go from one environment to the other. You can really see how I'm just trying to think of what the word is. Not immature. I don't think immature is a word for Western medicine, but it's really, in a way, it's not built on strong foundations at all, and you can tell really easily that it's very, very, I suppose, new to the world. You know what I mean?
Yeah.
And I used to have patients coming to me, you know, on a very regular basis in my Chinese medicine clinic, and I'd just be shaking my head hearing the things that they would be saying to me.
Yeah.
You know what I mean?
Yeah.
They'd be saying, "Oh, but this doctor said this and that doctor said that,"
Yeah.
and you'd just be shaking your head. And I'm not joking. Then the amount of times that I would just be left dumbfounded and shaking my head because of what GPs had said to patients, and also what GPs had been prescribing to patients for certain problems.
Right.
You know, you just be left dumbfounded a lot of the time. You know? So,
is there a particular example maybe that comes to mind?
Not
or
really.
One that comes over and over.
I'll be honest with you, Jane. Like. There was just so many of them. There were so many of them. But I heard one the other day, right? I heard one the other day. Now, this is an interesting one. And it wasn't my patient. It was one of my students told me that basically their daughter had gone through the HSC and been put on antidepressants. Now, I can't remember the whole story, but she was just saying she was put on antidepressants without her mother knowing at 17 by a GP, and then she put on weight and went back to the GP, and she was put on Duramine. Oh, you know what I mean? So you know, I suppose Duramine might be it may be a helpful thing for someone who's depressed, but you know, but anyway, you know, like she's put on antidepressant, put on Duramine, and then there was other issues as well, like reflux and all these different things, and it was just, you know, it's sort of like just like I've said to you guys before, it's like chasing your tail, you know, and there's a real stark lack of holistic sense about how to manage the body. Really stark, you know, problem there, and it's just, you know, sort of, you know, it, you know, after you've done Chinese medicine, it's almost, you know, like I said to you before, you just left a lot of the time just shaking your head, you know, about what actually goes on. And these are human beings, but at the end of the day, this is Australia, and we're a Western country, and it's understandable that we're in this predicament. But to be honest, it's really not good for patients at all. You know, so.
I know you've said in classes before, there is obviously a lot of benefit that Western medicine has to offer. Yeah. But so it's more in the implementation of it.
Yeah, you know, like obviously in some situations, you know, Western medicine is very helpful. Like if you go back 100 years in Australia, let's go back to, I don't know, let's go back to the First World War. If you had a headache, then what would you have done? You know, there was no Panadol, there was no Nurofen Plus or Nurofen, and you'd probably just have to suffer the headache out. You know what I mean? In those days, I don't know what they would have done, but you know, it's sort of like, you know. They've got these new things like Nurofen, and Jane, you're a pharmacist, right? Yeah. You know about Nurofen, and you know it causes kidney damage.
For sure.
You know what I mean?
If you take it for too long, yeah.
That's right. So not only does it causes stomach ulcers and different things like that if people don't eat it with food, but it damages your kidneys every single time you take it. You know what I mean? So anyhow, you know, I suppose in Western medicine they don't know about the sacred sort of I don't know, the sacred essence of what kidneys are, but to be damaging your kidneys every time you're taking a very simple medicine is not real good. And that's just one example. You know, I can give you lots of examples. I know a guy who took antipsychotics for 9 months and he put on 30 kilos. You know what I mean? What does that do to your diabetes and heart disease risk? You know what I mean? What other examples have I got? I've got plenty of them. But you know, they're just not on the tip of my tongue at the moment. But you know, some of these drugs are, you know, they may, like years ago, if someone had a headache in the First World War, yes, they might have had to suffer through it, but there may have been other ways to try and help that headache. You know what I mean? Certainly. Now that's Australia. Certainly, if you're in China, like I'm going back probably even 1500 years, then there would have been a non-invasive, or might have been a little bit invasive with acupuncture or something, but really a non-invasive, non-harmful cure for a headache that had been around for a long, long time, even before that. You know what I mean?
That's true.
So anyhow, you know, in some ways, like people might say, they might say people in Australia are very, very lucky because they've got a high standard of living, blah blah blah. They've got universal healthcare and all these things, but that universal healthcare is not really worth the weight that it could be worth. You know what I mean? So.
You mentioned earlier on that you were originally seeing Dr. Wang as a patient.
Yes.
Is this what sort of led you into this route of medicine? Had you been stuffed around with?
No, not really. He was like my first port of call.
Yeah.
Yeah. So I was just sort of, I'd done a bit of reading like I was telling you, and what happened was I just went into a shop one day and I asked the guy in the shop, do you know, because he was a Chinese guy, and I said, do you know a doctor who does Chinese medicine? And he showed me, because in the milk bar they had like Chinese newspapers, and he showed me Dr. Wang's ad in the newspaper.
Okay,
yeah. And I saw the yin yang, and I thought, well, that looks like Chinese medicine, and I rang him up, and that was it. Yeah. So really, I hadn't done any other looking around for this problem other than Dr. Wang.
Yeah.
And what a valuable resource he is, isn't he?
He is, that's right.
Yeah.
Yeah.
And we understand that you've done a little bit of Qigong practice as well.
Yeah.
And did that stem from as part of your therapy with Dr. Wang, or was that something else that you did in the background on your own?
No, he taught me Qigong.
Oh, okay.
Yeah, and but he didn't really teach me like a teacher teaches if you want to learn 1 + 1, someone can come along and say, okay, 1 + 1 = 2.
Yeah.
But he didn't teach me like that. You know what I mean? He basically might have said, who knows? He might have said to me. He might have talked to me about it 1 sentence every 2 weeks.
Yeah, right.
You know what I mean? And then eventually I got a bit of an idea, and then and he told me how to do it in the first place, but I just had to sort of just grab at straws and put it together.
Really drip feed.
That's right. And I thought, and eventually it was I thought it was of interest, and also I thought it was of great benefit, and so I just kept doing it and doing it and doing it. And then over the years I've been to be honest, I'm not really a person who reads a lot of books. I'm not really. I suppose you know, like what I have learnt, I just keep. You know what I mean?
More experience.
Yeah, and so I, you know, so to be honest, you know, like, you know, it is a good thing to read books, but I haven't done a lot of reading. But sometimes I come across a book and I'll read some pages and it'll give me a few extra tips about what to do with Qigong. But it's mainly I've mainly been self-taught at Qigong.
Yeah.
You know, and I never ever do movement Qigong. I always do sitting Qigong. Yeah. So yeah, some people might say, why do you do it? What's your you know, what's your goal in mind? Why would you do Qigong? You know, that they say, why would you sit in a room and you know, just say, you know, just sit there and you know, for me it's got a hell of a lot of meaning. And every single time I do it, I've got something personal that I'm working towards, but also along the way, it's quite interesting. It happens almost every time you do Qigong. You get, in a way, you get some knowledge or awareness. You know what I mean? So that's really helpful in life. You know, to grow. You know, to grow, go forward. You know, so it's quite interesting. You sit there and you in a way you think you're doing nothing, but all of a sudden, you know, you're finished and you've actually, in a way, everything in a way has been sorted out for you, which is really quite weird. But
and it doesn't kind of you can't go backwards with it. Sort of, it just translates into the other part of your lives. As well. It does.
Yeah. You know, I'm not really sure what you mean by that, though.
What I mean is that, say, you know, if you've done the practice and then something drops for you.
Okay, what do you mean drops?
So if you're thinking about a particular issue.
Okay, something goes wrong.
Something goes wrong and maybe this problem has been niggling at you for some time. Yeah. And maybe you find it through the Qigong? Is that what you mean? I'm just trying to clarify what you meant.
Often, if I've got a problem like that, I could also sort it out through cognition and also you know, things like reflection and things like that. And also sometimes if there's like quite a large problem or some sort of, you know, something that's a bit more substantial, then I'll definitely use the I Ching or the I Ching. But at its essence, Qigong, the way I see it is that you sit in that room and basically you work at being more and more still. Okay, so what happens? You focus on this point that we've talked about before in the lower abdomen. And then the rest of your things like your head becomes sort of nice and still and nice and set. You work, like I've said to you before, you work at sublimating heart, fire and kidney water. And what happens by doing that, I suppose you start to destroy your ego. And that's a good thing. And what happens is, once your heart is in a way cleaner, then you can probably relate to things that are bigger than you. You know, and when I talk about things that are bigger than you, my own perspective is that I'm here in this, like at the end of the day, yes, we're in Sydney, and then you live in where do you live, on Anzac Parade? Yeah, over that way.
Yeah.
But at the end of the day, we're all in the universe, aren't we?
Mm.
You know what I mean?
Mm.
So at the end of the day, if I can become empty and not grab onto, I suppose not grab onto. There's a saying that that the I Ching says, and that it counsels a turning away from the confusion of external things. You know what I mean? And that's an important thing that I carry with me, and maybe it might be useful for other people as well.
Mm.
But in a way, what that means is that you get your heart. You end up, in a way, supplementing the heart fire and the kidney water. What happens? Your ego will reduce, I suppose, and then because you've got this whole universe around you, maybe some of its knowledge can then come to you in a more easier way. Now, if I was to be worried about how my tie looked, whether my shirt was ironed, all these earthly things all the time, then I wouldn't have much time to get to know something like something bigger than myself. You know what I mean? So in a way, I would say that the universe, it's been watching for billions and billions of years, and it's got quite a bit of knowledge that in a way might be able to help me and help us. You know. Yeah.
So have you found that, or how has that sort of translated practically into your day-to-day life?
Okay.
Yeah.
So.
And has it changed the way you practice as well? How you see patients?
No, I suppose it's grown my awareness immensely. You know, I've got to a stage where, when I was younger, I was doing this and that, and I wasn't doing things that were really helpful to myself. But nowadays I do things that are helpful to myself, and to be honest, I'm very, very lucky to have guidance all along the way. And even in the last couple of weeks, I've noticed that things are with me every single second, and I'm not going to say this or that thing or whatever it might be, because that doesn't matter. But things are with me every single second to help me. Every single second. I'm not joking.
Sounds like you've have this huge appreciation for each little bit, each little moment that arises.
That's right. It's like guidance. A lot of the time I will have to, often I will have to, I suppose, obviously make effort to do things, but I might, let's say today I did 6 hours of lectures today. I went through that. I did that, and I made a few mistakes along the way, and that's natural. And I think at this stage I don't know about what might happen in the future, but at this stage I'm still making mistakes quite often. But sometimes I get told to. Sometimes I'm actually told to. I've been told things like, don't worry about certain things. Even if I'm having one thought that's not helpful to me, I've been told to stop it right away. You know what I mean? So it's quite helpful for me at many times of the day. So this is, I suppose, getting into the idea of Wu Wei, and you've heard about this idea before. Yeah. So basically, I would have learnt about Wu Wei a long time ago, but I'm starting to sort of realise that it would have been a few years ago. I really noticed that you know, things happen. I would say things happen for a reason. You know what I mean? And so, yeah, I suppose I'm moving slowly along that road towards Wu Wei.
Yeah, cool.
You know what I mean? Hopefully.
Cool. Yeah, that's a good place to move to, isn't it?
Yeah, that's right. Yeah, but I have enormous faith in the I Ching. I'm a funny sort of person. I have enormous faith in the I Ching, and if it tells me something, I will always usually follow it to the T. You know what I mean? And the thing I like about the I Ching is that you use your own imagination to come up with the solutions, and that so it's basically it's an interface between yourself and what the book says. You know what I mean? So the book might say this, but you use your own imagination to come up with what exactly it's saying to you. You know what I mean?
I see what you mean.
Yeah. So it's quite interesting. But I you know, that's one thing I have enormous faith in, and also I have I suppose I'm wary about you know, things that happen around me, but I'm also but if some stark things happen, I know to follow that road at the same time. So like let's say you've got 10 things happening all around you, and let's say like out of those 10 things, 2 things are saying one thing to do. There's 2 things saying another thing to do. 2 things another 2 things are telling you to do, and then you see one thing, and you know that's the one, and so that's the one. That's where I've got to go, and so yeah. I suppose faith's important, and I suppose knowing what to trust is important as well. Yeah.
So it sounds like the I Ching is like a guiding type of principle type of thing for you.
That's right.
And then at some places, or when you face certain situations where you need to face some kind of choice and there's a lot of options.
That's right.
Because you have the guidance there, it somehow has helped you to make the decision.
Yeah. Like Yi Jing is very good, but there's also a lot of other things that go on in everyday life that aren't involved with the Yi Jing that also help me enormously.
Yeah.
You know what I mean? So I'm very, very lucky, to be honest. Yeah.
I remember in our class, one of our earlier classes.
Yeah, start of last year.
Something like that. One of the very key principles you keep repeating.
I was saying,
you were repeating, was that you place yourself below patients.
Oh, yeah.
So this is in the clinic setting, but this is something that Gav and I remember.
Oh, okay.
And we thought if you can sort of elaborate on it, and why and that sort of thing, because it's...
Oh, well, that's easy.
Yeah.
Basically, and I would have said this to you at the time. The only you know, I was saying to this to students today. You know, and I've said this to you as well. I've known my wife for 13 years, but I don't know her very well. You know what I mean? I really don't know her very well. So we're lucky that I suppose that we've got a system in Chinese medicine that I suppose in an hour we can get to know that patient quite well in some ways, for basically to manage their certain problems. We've got a pretty good system to manage their problems. But at the end of the day, as I've said to you before, I sit under the patient because nobody knows a patient like they do. You know what I mean? nobody knows a patient like a patient knows themselves. So you're always, that's what I've said to you last year, listen, you know, and that's what I did. And, you know, like I suppose there's all different types of practitioners around, but I think you learn a lot more when you listen more. You know what I mean? If you sort of, I suppose if you're too gung ho, it doesn't help you. You know what I mean? Yeah, you gotta. I suppose. Well, you know, I suppose one thing is you got to appreciate the position you're in, and the other thing is, you know, these patients are giving you so much respect, and you've got to reciprocate that respect, I suppose. And so, and like I said, the patient is the expert on their condition. You know, as I said to you, I've known my wife for 13 years, but really I still don't know her. But to be honest, myself, I know myself quite well. You know what I mean? Because I live in my body.
Yeah.
You know, I know myself quite well.
Yeah.
So it's the same with patients. Patients know themselves really well. You know, and so what you do is listen to them.
Yeah, okay.
You know, and sometimes you know you've got to sort of cut them down a little bit because they're going off waffle on any sort of topic, but you know, you can use your questioning very efficient. If you can use your questioning very efficiently, you can get a lot of information out of the patient. Let the patient talk. Let the patient, oh yeah, and this and that and this and that, you know, you can really try to get to the bottom of things. But you've sort of seen how I work in CMCS 121.
Yeah.
You know what I mean? Basically, you listen. First of all, you listen. First of all, you greet. You listen. Then you analyse. You do your pathogenesis, and that's always, I suppose, a creative job in itself. You know, doing that sort of work, and then you choose your treatment, and you go from there. But yeah.
So would you say listening is one of the key characteristics that you know, a good practitioner should have, amongst other things? The top one?
Well, for me it is. For me it is. But to be honest, you know, other practitioners are not always like that. You know what I mean?
But for you,
for me, it's important. But you look at Dr. Wang or someone like that. I wouldn't say he would be you know, really massive on listening. Some of that I suppose would be down. When I used to see him, probably some of that was down to his language. But I used to write down the stuff that was happening to me on a piece of paper, and I'd give that to him, and he used to go through that. And I suppose when you've got that much experience like he does, you don't need as much time. You can just go straight to the problem a lot quicker than, say, someone like me who hasn't got as much experience. You know what I mean? So he you know, I reckon a lot of the time he wouldn't need as much time to do all this this questioning and sort of stuff like that. But you know, I would, you know, tend, if it was a serious problem, I'd tend towards getting all the information I can, and then trying to tie up every single symptom with a syndrome. You know what I mean? And then look at all the syndromes together. You know, probably on a list, and then try and map what's happening in the person's body. And in some instances, though, Jane, you don't need to do much listening whatsoever, because you know, okay, well, this is, you know, you just go about your business. You don't need to. You've seen it so many times before, like a little bit like like Dr. Wang has, and you just know exactly what to do. But you know, there is a fair bit of art in Chinese medicine, and if you can, you know, I still believe strongly in syndrome differentiation. You know what I mean? I don't believe in a blanket approach to Chinese medicine. I think every single patient is an individual, and they need to be, I suppose, you know, treated like that in a way.
Yeah.
Yeah. So. Yeah.
So in summary, sort of sounds like cultivating your ability to listen has been a huge thing for you. At the same time as calming your mind, like clearing your mind of chatter and junk. And it sounds like you've worked really hard with everything you've done for it.
Yeah, you know, like I'm a bit of I've in the past I've been a bit lazy. Like I look at myself and I say I'm a bit lazy, but other people would look at me and they'd say, like my mother would never say I was lazy. You know what I mean?
Yeah.
But
It's hard.
What's that?
You worked hard.
Yeah, I know, but I like with if I look back and look at the language, I could have done more there, but I didn't really have enough time. I really didn't have the time, and then there's been a few other things that I could have done more with, but I suppose you just go along with what's happening at the time, don't you? And I suppose you can only do what you can do.
Yeah.
You know, but yeah. So, you know, at least I'm out of. I'm just glad that I'm out of that. Where I was, that Western medical school where I was. That was hard, you know. I'll tell you a quick story before we're finished.
Yeah.
And I think I might have told you before. There was a lady who I treated who had been on corticosteroids for 35 years.
Wow.
Right? And
Possible side effects.
yeah, and side effects of corticosteroids, as you know, are osteoporosis, etc., etc. And this lady, this surgeon had basically, she'd gone to see this surgeon who was an orthopedic surgeon, and he'd done 12 operations on her bones trying to help her. And you know, this is like you know what I mean? Like this is the type of thing I was seeing, and so a lot of that stuff that when I was you know, doing a lot of hours in clinic, I don't see anymore. You know, and I suppose having to work in a medical school and seeing that at the same time was a real challenge.
Yeah.
You know what I mean?
You've been fighting yourself.
That's right. And coming here was like, oh, thank goodness.
Fresh air.
You know, I can teach something I love now, you know?
Yeah, great.
So, but at the same time, I still know what they're doing.
Yeah.
You know? And so my research now that I'm doing now is all about trying to educate, and I don't know if it'll ever happen, who knows if it'll ever happen, but trying to give them at least a bit of education about what we're about, and you know, see if they can I don't know, not approve of us, but at least sort of, what's the word for it?
Be more accepting.
Be more accepting towards us, and you know,
a better awareness.
That's right. Having it. That's right. And at the end of the day, it's about respect. You know, like, come on. You know, like I know. You know, it's like there's this saying, and I've said it to you before. The most popular things in the world are the worst for you, and the most unpopular things in the world are the best for you. And I really believe in that saying. That's a real Laozi saying, you know. So, you know, McDonald's is the most popular; it's the worst for you. Lentils are the best for you, and nobody eats them. You know what I mean? That's Australian. That's the Australian health system for you.
We've got faith still.
Yeah.
So. All right. And Thanks for your time today, Paul.
Yeah.
No problem.
Really
Thank you very much.
appreciate it.